But tonight, our focus is back on COVID. And the reason it's been back is because more than 50%, 50% of the cases at the moment are coming on a daily basis from the state of Kerala. Remember, Kerala has always been lauded over the last 18 months, not necessarily just by TV anchors, but by virologists and experts across the world for its COVID containment strategy. Questions, therefore, are now being asked. Why is it that Kerala is the one state that is seeing more than 20,000 cases on an average per day for the last few days? Has something gone wrong with the Kerala strategy? Did the relaxations for Eid make a difference? Or is Kerala actually a victim of its own success because fewer people have had antibodies? The BJP is taking a dig at the Kerala model and looking at Bakri Eid for the spike. The truth lies in Gopi. Here, report here. Take a look.
The famed Kerala model is under test. Once hailed for its COVID management, the state is now witnessing a huge surge in coronavirus cases. At an alarming test positivity rate of 12.35%, Kerala accounts for 50% of India's daily cases. It now has nearly 1.5 lakh active cases out of nearly 4 lakh in India, or roughly 38% of the national caseload. The state has reported over 22,000 cases for 2 days in a row, and it has been reporting over 10,000 cases since 20th July. The centre has now rushed a team of experts to Kerala to help in the fight against COVID. There are 10 districts in Kerala that have a test positivity rate higher than 10%.
देश में 22 ऐसे जिले हैं जहां पर कि पिछले 4 हफ्तों में हमने एक इंक्रीजिंग ट्रेंड इन केसेस नोट किया है। यह वृद्धि एक मान लीजिए कि लिमिटेड नंबर ऑफ केसेस से थोड़ी भी वृद्धि है तो यह कॉज ऑफ कंसर्न है जिसके लिए हम स्टेट से डिस्कस करते रहते हैं।
This letter that has been written by Union Health Secretary Rajesh Bhushan to the Kerala government talking about the fact that the central team that visited Kerala in the first week of July has made some observations about what really is going wrong in the state. Containment has to be improved in the state of Kerala. This letter also talks about the fact that certain super spreader events have been witnessed in the state of Kerala, which has clearly led to the spike.
The BJP has blamed the Pinarayi Vijayan government for allowing 3-day relaxations in COVID curbs during Bakri.
We just need to really find why the numbers are going up, why it's not come down, while nationally the numbers are going down. I mean, because we have an excellent medical infrastructure in Kerala, why is the numbers not going down? It's really a big mystery. And everybody is wearing a mask in Kerala as well.
The Kerala government claims the health infrastructure is capable of handling the jump in COVID cases. According to government data, 56.2% of COVID beds, 40.4% of ICU beds, and 41.5% of ventilators are available now. But adding to the state's COVID woes, there is also a crippling crunch of vaccines.
There is a plan to campaign against the state, I think, the Kerala state, because as you all know, all the experts in different states say that we have a very good system or we have a very good defensive mechanism.
Frustration is growing among the people over the prolonged lockdown restrictions due to the COVID surge.
വ്യാപാര സ്ഥാപനം തുറന്നു പ്രവർത്തിച്ചാലും കോവിഡ് നിയന്ത്രിക്കാൻ നമുക്ക് സാധിക്കണം. അതാണ് സംസ്ഥാന ഗവൺമെന്റ് കേന്ദ്ര ഗവൺമെന്റ് ചെയ്യേണ്ടത്, മുൻകൈ എടുത്ത് ചെയ്യേണ്ടത്.
Once hailed for its containment efforts, Kerala has now a new challenge on its hands as the threat of a third wave looms large. With Gopi Krishnan Unnithan in Thiruvananthapuram, Bureau Report, India Today.
So let me go to my first guest tonight. My newsmaker tonight is Kerala's Health Minister, Veena George, television anchor turned politician. Appreciate your joining us, Veena. The question that everyone is asking, What has gone wrong with your Kerala strategy? Your critics are saying that here was a state that everyone was lauding a few months ago, but now you have the maximum number of cases in the country. More than 50% of the new COVID cases today came from Kerala. You are the COVID hotspot. 3 consecutive days of more than 22,000 cases. Has something gone wrong with your model or your strategy, Veena George?
The second wave started in Kerala by the middle of April, and we had our maximum number of cases on May 12th. On May 12th, we had more than 43,500 cases. And then the number of cases went on decreasing, and then we entered a plateau. And still we are going through that plateau, although we have a ascending trend in our state. Our TPR is almost around 10%, 11% or 12%.
No, ma'am. Let's look at it this way. You are saying that you use the word plateau, that Kerala has plateaued the wave. You didn't have the high spikes that other parts of the country witnessed. But the fact is, ma'am, the rest of the country now has sharply declined from the highs of the second wave in April and May. Kerala may have plateaued, but in the last 10-15 days, once again, we are seeing a rise to more than 20,000 cases in a day, while the rest of the country, many parts are in single and double digits. You are saying the test positivity ratio is between 10 to 13%, but that's again high. The rest of the country is declining. Kerala continues to register strong numbers. Does that worry you or not, ma'am?
See, during the second phase of the wave, the disease is getting spread due to the Delta virus. And as you know, in Kerala, we do the maximum number of tests. Yesterday, we did more than 1,96,000 tests, and today we did more than 1,63,000 tests. And we are doing targeted tests because if we find one person positive, what we do is that we test all the persons around him, in his contacts, all the primary contacts, the secondary contacts, all the tertiary contacts. So the chances are very high that all the persons that we test, or in all the persons we do the test, there are chances that they will be positive. So the TPR, the test positivity rate will be very high.
So you're saying Kerala is doing targeted testing, and because of the targeting testing, the numbers are high. But then other states are also testing now, ma'am, fairly large numbers of similar size population, Assam being an example, for example. But we are not seeing the same test positivity ratio in those states or the same caseload as Kerala at the moment. Now, I want to understand why. That's why we want to do this. The seroprevalence survey, ma'am, of ICMR shows that only about 42% of Kerala's population has got antibodies compared to the 67% in the rest of the country. This suggests that you have a large vulnerable population out there at the moment.
Yes, the number of tests is very high when we compare the total population of the state. We have 3.5 crores of people in the state, and the tests we done per million, when you compare it with the other parts of the state, it's very high. So the test per million is very high in Kerala, and also the vaccination per million we do is also very high. As you said, the ICMR study, the seroprevalence study, shows that only around 42% of the total population in Kerala is so far infected or have developed antibodies in their body, and it can be either through vaccination or because they are infected by the virus. So it means that more than 50% of the total population is still vulnerable and susceptible to the virus. So it shows that our preventive mechanism was very good, that we were able to, or we were successful in protecting our people from the virus. So the only way before us is to vaccinate our people, and we are doing the vaccination in the best way possible. Also, we have a very good system, and the vaccination, if you check the COVID portal of the central government, the vaccination per million, the first position is ours. So the next is Gujarat, and it goes on like that. So the first position in the vaccination per million rate is also, it's Kerala.
Ma'am, Ma'am, you are the first position in vaccine. You are actually the second. May I correct you? You are the second per million after Himachal. Then there is Gujarat when it comes to vaccination. But while you are vaccinating a large number of citizens, you are also adding a large case load. The fact is, many believe you were successful in the first wave in your containment strategies, but maybe Kerala let its guard down in the second wave. It started with the elections in Kerala in March, April. Then there were pressures on your government to open up shops. You did alternate days opening up of shops, but now we are seeing Bakri Eid relaxations a few days ago were allowed. Your critics are saying that the Kerala government, especially during the Bakri Eid, should not have allowed the relaxations in this ad hoc manner for 3 days. Either you allow complete relaxation if you believe the situation is under control, but you can't allow it for 3 days for a religious festival. Did you let your guard down, ma'am, in the last few months in the second wave? Did you get overconfident?
This was the case during the first wave too. You may be remembering, because in January 2021, we contributed the maximum number of cases in India, and I remember almost 50% of the cases in the country was from Kerala during January 2021 too. Why? Because we have always tried to drag the wave. We have always tried to keep the number of patients or the number of positive cases below the max medical capacity threshold. In Kerala, there was never a case where there is a patient who died without getting oxygen or without getting hospital bed or without getting ICU facility. So we always tried we ensured that all our people, those who are infected, all the positive cases, they do get hospital aid and they do get oxygen support, or if they need ICU support, we ensure that they are also getting ICU support. And in this phase, if you go through the data, you can see that the hospital occupancy is very less. And as I told you, the test per million in Kerala is very high. When you compare the total population, we only have around 3 crore 51 lakh people in our state. But when you compare the tests done with the total population, it's very high. Also, we are doing targeted tests, and also it is because of the Delta virus. Yeah.
No, ma'am. I am not disagreeing with the achievements of Kerala. I'm not trying to minimize your achievements. But the fact is, I asked you about letting your guard down, especially during Bakri Eid. The relaxations for which even the Supreme Court has pulled up the Kerala government warned that you should not have done it. Do you believe in hindsight that some of those were mistakes, like Bakri Eid relaxations, that some of those districts now where numbers have gone up like Malappuram is a worry? Could that be because of relaxation and allowing this overcrowding during these 3 days? Are you under various pressures? Merchants and traders want you to open up, religious groups want you to open up, and the Kerala government is in a bit of a bind.
Sir, during those days also we had TPR was around 10, 11, 12 like that. And here we have a coordinated effort, all the coordinated activities of all the departments, the police department, the LSGD, the health, and also the people are cooperating very much to control the disease. And I'm so sorry to say that it's quite unfortunate that there is a campaign against the state saying that the system has failed and all. But when you see the virologists, the experts, when they say that Kerala is a system in Kerala is very good still now. Why? Because the density of population in Kerala is very high, and it is double the national average. So here we have more than 860 people in 1 square kilometer.
Ma'am, density of population is also there in Mumbai, but cases are coming down. Let's not, my point is, ma'am, you seem to have no regrets at the moment for allowing any lifting of restrictions. I'm just trying to understand that questions will be raised. Onam is coming. Will you allow similar restrictions and will you allow similar opening up? Will that lead to another spike? It appears that while you tell me on this show that you have the situation under control, the fact is your government has just today announced a further clampdown, a lockdown on 30th, 31st. Does that suggest that are you worried in a way that you're now going to have a strict 2-day lockdown over the weekend?
So we cannot keep the people in a lockdown, or we cannot keep the people in their house, shutting their their shops or their institutions and all. So the government of Kerala is vigilant in this part of in this phase of the second wave, and these 2-3 weeks are very crucial. And we are closely monitoring the situation.
No, but the very fact that you've decided to enforce this strict weekly lockdown, does that mean in a way that you've realized that while you need to open up and ensure that livelihoods are not lost, at the same time the worry of these 20,000 plus figures for the last few days means that you can't lower your guard and fully open up? Kerala is caught in a bit of a bind.
So we have weekend lockdowns. We have lockdowns on Saturday and Sunday, and we are asking our people to remain in their houses during Saturday and Sunday. This is a collective decision. It's a collective decision of the state, and it's a decision of the review committee chaired by the Honorable CM. And all the departments are there in that committee, and the health department will give all the data, and the committee will review the situation in the state. And we have categorized all our LSDDs, all the panchayat, municipalities, corporations according to TPR. So from 0 to 5% TPR, if we give relaxation. And from there will be more relaxations in the group from 5 to 10, and from 10 to 15 there will be more relaxations, and it will be like that. And there will be triple lockdown in those LSDDs where the TPR is more than 15%. Why the TPR is high? Because we are doing targeted tests.
Ma'am, you keep saying you are doing targeting testing and therefore the TPR is high. I'm willing to concede that. But let me ask you then, if you are so confident, A, will you then start opening up? Will you, as I said earlier, open up for Onam? Will you allow that to take place, your biggest festival, with greater, allow it to be fully open? Because in a way, otherwise, you're going to become a victim of your own success. That you enforced a strict lockdown, especially during the first wave, has meant that your sero prevalence is less than many other parts of the country. People in Kerala don't have the same antibodies that they have in other parts. So I ask you, has the time come, perhaps starting with Onam, for actually Kerala to open up, allow people to go outdoors? That's the other way to look at it.
We are doing review meetings every alternate days. So tomorrow also we have a review meeting. So we are analyzing the situation, and we are analyzing all aspects of the situation, and we will be taking decisions accordingly.
You're being very, very diplomatic there, ma'am. There is one more charge against your government, and that you are fixing COVID data. The opposition has said that there are about 7,000 cases that are being undercounted. The leader of the opposition, V.D. Satishan, says he claimed he got that data through an RTI. The total toll, he says, is 23,486, not 16,170. Are you also guilty, ma'am, of undercounting?
We are doing excess death analysis, and the government has already declared our position. If there is any complaint or if anyone is left out, we'll definitely include that, because when you go through the excess death analysis data of different states in our country, you can see that the excess death analysis show that even if there are underreported deaths in our state, the number will be very less when you compare it with other parts of the state. Even then, the death rate will be less than, it will be somewhere around 0.8, or it will be definitely less than 1%. So which shows that the death rate in Kerala is, again, and even if there is anything like that, then also the death rate in Kerala will be the lowest in the country.
Ma'am, the fact is your case fatality ratio in this second wave has gone up from about 0.4 to 0.56%. Clearly more people have died in Kerala in the second wave, and God forbid, the worry is that this second wave, if you allow it to prolong further and you're not able to bring down the numbers, could well be carried into a third wave, and Kerala in a way could become a springboard for other parts of the country. That's the worry.
We are now doing online real-time entry of the deaths, and we are doing it from the hospitals, from the institutions itself. The doctors can register the death online, and the declaration will be done at the district level. So we make sure that all the deaths are being reported, And soon after the new government saw in, we formed a new software, or we created a new software. And from June 16th onwards, through government order, we have asked all the institutions, all the hospitals to do the real-time entry of the deaths to make sure that no COVID death is underreported, or it's
But
not reported.
are you not worried, Veena George, that the longer these numbers remain in the 20-25,000 range, the more worrying it gets? I mean, the more you try to prolong the wave, in a way, you could get caught up with new variants emerging. Do you really believe that the worst is over, that people are exaggerating what's happening in Kerala?
See, what we find is that at this part of the second phase, second wave, we have more breakthrough infections. Because the less hospital occupancy, the less ICU occupancy, or the less demand for oxygen, it shows that we have breakthrough infections, more breakthrough infections, because the infections are more in those people who are already vaccinated. So the severity of the disease is very less. If that is the case, we are trying our best to decrease the number of cases, and we are increasing the tests, and also we are making sure that every single case is being reported. And also in that case also, the study showed.
Ma'am, you're trying to give up, I understand where you're coming from in a way, because Kerala has a reputation to protect, but despite the high level of vaccinations, for example, there is a case rise. I mean, that to my mind, as I said, you seem to be becoming a victim of your own success. A large proportion of your population is vulnerable, as the Sero survey showed. You may have high vaccinations, but you're getting a high caseload. Why not accept that now and then find solutions for containment?
Yeah, because that's what I was trying to explain now, because we have more breakthrough infections now, and we are trying to give more vaccines to the people, and we are requesting the central government to give us more vaccine, and we are asking the central government to give vaccine on the analyzing the percentage of the vulnerable or the susceptible population left. So I think that's the highest in the country. So we are requesting for more vaccines.
Are you telling me today that you're not getting enough vaccines from the center, that you can vaccinate far more people?
They are. We are looking forward. They are giving us vaccine, and yesterday we got more than 9 lakh doses of vaccine. So we'll be vaccinating, and that the people with these doses of vaccine. Today we did almost 2.5 lakh vaccinations, and tomorrow also we'll be doing that. So in 3 days we'll be.
Ma'am, listening to you, it appears that you seem to be fully in control. If the situation was so much in control, why is the centre sending a COVID management team to Kerala? Clearly the centre believes the situation is not under control.
We are welcoming them, sir, because I think this is the second team from the central government visiting Kerala in a couple of weeks, and the last team, I had a discussion with them, and they told us that they are very much satisfied with the way we manage the pandemic, and they are not at all worried about the TPR, because this is expected in this second phase, because the Kerala, as we know, we have more vulnerable, susceptible population, so this is expected. They said the communication was like that. Yes.
My final question, ma'am. Today, when I see my Twitter timeline, I'm seeing lots of people, many of them associated possibly with the BJP in particular, saying that, look at Kerala. You all were screaming horse about UP, but look at what's happening now in Kerala. When people from, let's say, Uttar Pradesh, Bihar, Delhi will look at the figures and say, just because of Kerala, India's case numbers are looking high, we will get a third wave in the country because of Kerala. Kerala has failed. Kerala's model is based on PR. What will you tell all those people?
With the second wave was started by the mid of April, and the Delta, the virus, here we have the Delta variant in the second wave, and the chances in Kerala is very high that the disease will get spread easily. We are trying to control it, And the only thing we have to say is that everything is under control, and we are trying our best. The government is trying our best to protect our people from the virus, and the people are really coordinating to all the measures adopted by the government.
You know, in a way, ma'am, you've given us, at least for the first time in weeks, months possibly, an explanation as to what is happening in Kerala from your perspective. And for that, we've been chasing you up for the last few weeks. I appreciate your joining us. Your predecessor, Shailaja, teacher, became rather famous. And you as a TV anchor turned politician, I wish you well. You have a tough task ahead of you. Thank you very much, Veena George, for joining me. Thank you. Okay, let's now we've heard the health minister, but I want to still focus on this and decode what is happening, and let's try and find out this Kerala paradox. Is the state really staring at a monster surge? Has Kerala failed the COVID test as some are suggesting, or have they invited a third wave as others are suggested? Was any of this linked to Bakri Eid? Is there a need to rethink Kerala's strategy, and is Kerala a victim of its own success in containing the virus in the first phase? Professor Gautam Menon, Ashoka University, joins us. Dr. Anish T.S., Associate Professor, Trivandrum Medical College, been associated with Kerala's COVID task force. And Dr. S.S. Lal, public health expert, also joining us, who's been critical at times of the Kerala government on these issues. I want to come to you, Professor Menon, first. You heard the health minister there. She seems to suggest all is under control. We were prolonging the wave. That's all that's happening. Our fatality rates are low. Our testing is high. Do you think she's right?
I think on some parts, there is certainly a need to worry. For example, test positivity in excess of 10% is not a good situation to be in at any point. But on the other hand, there are some positives. The case fatalities are still below the average for India over a longish period, although they're slowly creeping up. That's a positive. We're not seeing an overwhelming of medical infrastructure, of health infrastructure so far. Still, there are empty ICU beds, there are empty oxygen beds, etc. So I think Kerala is in a unique position because it has the lowest seropositivity of any of the states of India. So there are many people to be infected. And this is a delicate time for it. I suspect that they will be able to control this. They're doing all the right things. They're vaccinating at a large fraction. They're testing well. I suspect overall I'd be positive, but I would be very watchful over the next few weeks.
Why you said the one worry is that test positivity ratio remains between 10% to 12%. Now WHO wants, believe that it must be below 5. Why do you think Kerala's test positivity ratio is so high? It cannot be just because of high testing. Is it the serological survey that not enough people there have antibodies?
So certainly there are people to infect, which is one reason why the disease is spreading. The other thing is probably because of not enough attention to how they opened up. At least from what I hear from Kerala, there have been instances of fair amount of crowding in shops, and shops have been open for smaller periods in the day rather than for long periods. It's usually a good idea to ensure that any crowding is really controlled, and if necessary, have shops open for a longer period so that fewer people can be there in those shops at a given time. I suspect this, a combination of the opening up for the religious festival that you mentioned, all of this together contributes to maintaining a high TPR. But on the other hand, it's still a sort of point in Kerala's favor that this has not prevented, this has not led to health infrastructure being overwhelmed.
That's interesting. Dr. Anish, the glass can be half full, half empty at the moment. Do you see, Dr. Anish, the glass is in Kerala still as half full? Or do you believe the last month has led to serious concerns over containment strategies?
Before answering that question, I want to say something that as Kerala's position is very unique. Sometimes Kerala may be right, sometimes the rest of India is right. So the real question is something like that. And you look at the seroprevalence data, you can see that Kerala's seroprevalence is lowest in the country. Is it because of lack of vaccination, or is it because of lesser infection? It is not because of lack of vaccination, because Kerala vaccinated much more compared to an average Indian state. And it is actually among the big states, it has got one of the maximum vaccinated communities, Kerala's community. Then that means the real infection that was happened in Kerala is much less. Was it a success in a fight for COVID, or is it a failure? Do you think Kerala's containment strategies were not work? If it is not work, why this much less percentage of this zero conversion or this much zero prevalence. So Kerala's containment has worked well, and even Google mobility data is also showing that Kerala is the place where the containment strategies work well. It is actually because of the containment strategies work well, we are getting more number of cases now because we have got a very large amount of susceptible population.
No, that,
So again, you are
that's
saying
precisely
that
it. You're a victim. You're a victim of your own success. You're a victim of your own success in the first wave. But you needed possibly a different strategy for the second wave. You needed a different strategy maybe in the last 1 month in particular.
Okay, please just hear me what I want to say. We are not victim of our success because the number now is different from the number that we would have experienced in April or May. Because now almost 50% of our population is at least one dose of vaccination, and a lot of breakthrough infections are there. Our elderly people and people with comorbidities are completely protected by vaccination, and now the disease is happening to younger age groups, and we have got enough beds in our hospital. So how can we prevent? How can we get that kind of a herd immunity threshold that is almost equal to 65% that in India's the other states have it? What is the gap is 21%. How we can build that 21% gap? Either we have to vaccinate more, or
you have to stop prolonging the lockdowns. You see, in a way, maybe the second wave does not require these kind of harsh lockdowns. Let me take that to Dr. Lal, because Dr. Lal has been among the critics of that. Dr. Lal, do you believe that Kerala needs to now start because otherwise the serological survey numbers show this wide gap. Kerala well below the national average in terms of antibodies. It's a dilemma for different states. How much do you open up?
Yeah, see, there are a lot of other things to be discussed, basic things. You said we are victim of our own success. I would say we are in the prison of our own image. So Kerala has its own image, and we are trying to hide many of the facts, and we are trying to not look at many of the facts. So simple arithmetic, I'll tell you. See, before the elections, we were doing hardly 50,000 tests per day. There were political reasons also, mostly political reasons. And now we are doing close to 200,000, 2 lakh tests per day. So when there are more tests, there will be more more cases detected. That's very commonsensical. Then when you do more tests, the test positivity should come down, which is not happening because there is increased transmission. Transmission is at a very high rate. So there are alarming things to be concerned about, and I would say things are not under control. The problem is that we don't know exactly what is happening.
No, why is the transmission? Why do you think transmission has increased suddenly?
See, there were so many reasons. That's why there are other issues. It's not just Bakrid or whatever. See, we had our local body selections many months ago. We told, including Indian Medical Association, told the government to postpone it so that it can be together with the assembly election. Government did not listen because government knew that they will have majority in the local body election. They want to leverage out of that election. So they did that election. So many months ago, the entire people were out doing demonstrations, and when we had high levels of COVID, and all parties were there. Then came this assembly election. So 2 elections in a span of few months. That actually the entire. See, I'll give you another example. And you were mentioning about Onam. Last year Onam, 1 year ago, the institution where I am working as a professor, we did a study. 95% of Keralites were wearing masks. When people are told something, people listen to what governments say, because we are very literate, educated, and we are very aware of health. And so this is how society reacts. Then came, everyone was on the road shows and things like that. 2 elections, we lost complete control. And what happens is actually, Kerala government, that's what I'm worried about. The new ministry is also doing a lot of things. She is trying to rectify some of the previous mistakes. But the previous ministry had done a lot of mistakes. They tried to hide everything. There's a big issue in Kerala.
What is the biggest mistake? What is the biggest mistake you think Kerala has made, Dr. Lal?
We did not do enough number of tests. Dr. Anish also knows. We were demanding for at least 100,000 tests per day. Even the chief minister said we should be doing 100,000 tests per day. Because it was election, they reduced it they kept it around 50,000, which means we did not detect many cases. Those people were walking around and spreading the disease.
So you believe
That's
that,
one thing.
Yes. You believe that election period turned out to be a critical period. What's the other big issue?
Then came both the elections. Then people were, Kerala is a very crowded place, very highly densely populated place, and we are a mobile population. We move everywhere, and plus elections. So every person was mobile in this state. So which makes Kerala a fertile land for.
I take your point, but Professor Menon, there are those who will say that what Kerala has done is, in a way, it has avoided the sharp spikes. 60,000 a day, 75,000 a day, over a lakh that other parts of the country have had. Therefore, the strategy of prolonging the way, of plateauing it, while these numbers may appear high at the moment, it is still a better strategy than having high spikes and lows if you really want to contain the pandemic. Is that true?
No, there were cases. We were not detecting it.
Yeah. Okay, you're saying there were cases you were not detecting. Go ahead, Professor Menon.
No, that's absolutely true. That's called flattening the curve, which is basically to put in all the interventions that you need, the testing, the isolation, etc., to ensure that your cases never cross the threshold of what your medical system or health system can actually bear. And the consequence of this is that it's spread out over a much longer period. It's a little worrying that the test positivity is in excess of 10%. But as was mentioned earlier, this is because there's more circulation outside, more mobility. Also, the large reservoir of people who've already been, who have not been infected, which gives rise to the relatively small values of seropositivity. Kerala is setting a good example. I mean, the ideal case is a low seropositivity, a large rate of vaccination, and spreading out the cases over a longer period so that your medical system is not overwhelmed. All of these things are correct. The hope is that this can be sustained long term, that they don't open up to festivals, they don't open up to other political activity, and they use lockdowns judiciously as a way of controlling the number of people who are circulating outside at any point. They also worry about ventilation, closed spaces, etc. All of these things should go together. But I think on the basics, keeping a low seropositivity and having a large rate of vaccination and spreading it out, they've all done well.
Okay, so it's a mixed bag. When we look at Kerala, we've tried to today analyze the numbers, look at them closely and give you a sense as to why Kerala has become the country's COVID hotspot. The debate will continue, and we didn't want to make it a politically polarized debate. We wanted to bring in people who understand epidemiology, and I hope that many of our viewers, particularly those on social media, will also start reading up. Thank you all very much for joining me on the show tonight.